everyone, I'm Bethany, registered nurse here with Veritas, and I'm here to talk to you about nurse coaching and what is nurse coaching. So I just want to start with saying thank you to all of you who took the time to fill out the survey that I sent out a few days ago. It really gave me some valuable insights into what you guys understand about nurse coaching and what you're looking for in this service. It's, as many of you know, I have been working on my nurse coach training for the last 6 months or so, and I'm set to graduate May 2nd, and then I'll be sitting for 2 board certifications for holistic nursing and board certified nurse coach. And so thank you to those of you that were in my practicum and my guinea pigs for my coaching sessions. And we're getting ready to launch this in May, and I'm super excited. It's something I've been working really hard on. It's something I'm super passionate about, and I'm really excited that Dr. Arnold has given me this space and this platform with Veritas to implement this here. And I think it's going to be a really great service for those of you who want to work on improving any health or well-being or vitality. So on the survey, the big feedback that I got was that a lot of you don't understand what is nurse coaching. And so I just wanted to make this video real quick and just kind of talk to you about what is nurse coaching, right? Kind of weird. So nurse coaching is a registered nurse who has coaching training. So coaching is a very specific set of skills in communication techniques on how to bring about and help facilitate positive changes in a client. And so as a registered nurse, I have a lot of background knowledge on healthcare issues and not a lot of training in how to help convey that to my patients in a way that's actually meaningful and gets them to make those changes. So that's why I decided to go through this nurse coaching training, is because for the last 10 years that I've worked in primary care, I've told a lot of people, limit your salt intake, exercise more, and a lot of that, people will yes me in the office, and then 6 months later they come in for their follow-up and we're at the same spot and just giving the same advice. So coaching is a way that can really get people, if you want to change those health behaviors, to help facilitate that change. So the first thing we do in our sessions is we sit down and we identify what your goals are, what your vision is for your health. What does health mean? What does well-being mean to you? What does vitality mean to you? Does it mean being able to go out for long hikes? Does it mean going out to play pickleball? Does it mean keeping up with your grandkids? What is the vision that you have for yourself as you age? And then we identify, okay, so what do we need to do to get there? We start to plan and strategize. What are some kind of big picture items that we need to do? And then we'll break it down. Okay, so what are our short-term goals? And then what are these micro goals and micro habits that we can start to stack up on each other so that you're really starting to make a lifestyle shift that's compatible with your lifestyle and things that are important to you. So we'll recognize and we'll leverage your strengths. A lot of people don't even realize what strengths they have. And so working with a coach will really help to bring those out and bring those into focus and figure out how we can use your own strengths, use them for you in a way that gets you towards those health goals that you're working towards. We're also gonna anticipate barriers, and we all have barriers. That's why we haven't done these health goals that we are intending to do. So we're going to talk those through. Go over what are the barriers to what you're trying to accomplish, and what are we going to do when we come across those barriers, and we will come up with game plans and really just work through that, so that way when you come across that situation you feel prepared and ready to go. And I'm there to hold you accountable. A coach will, every time we have a session, we'll check in. How did you do with your goals? What was your progress? Okay, you didn't hit those goals. What did you learn from that? And what are we going to do moving forward? So having a coach in your corner gives you that new level of accountability that you don't often have when your doctor says, okay, I want you to exercise more and I'll see you in 6 months. Working with a nurse coach just brings that accountability to a whole different level. So working with a nurse coach, it's holistic, right? I'm not just looking at what you're eating and how much you're exercising. We're looking at the whole picture of you. How are you doing, not just with nutrition and diet, but how are you doing as a person? How is your work-life balance? How are your relationships going? How is your spiritual health? If that's something that you want to dig into. we look at the whole person, and sometimes if your work life is out of balance, we need to adjust that before we can really start to get an improvement in your blood pressure. So we just take a look at that whole picture and you as a whole person, and it's transformational. With these coaching sessions, I want to go more than just surface level. Here's what you should eat. Here's how much exercise you should be doing. Because if it was just surface level, we would all do it. But there's something deeper, and we're gonna dig into that, and we're gonna make this transformation of you as a person, so that way you can just become this vision of yourself that you have, that you want to be, to have health and vitality. And I'm really excited for this. So what am I going to do to help you? I'm going to listen to you. You're going to be listened to in nurse coaching like you've never been listened to before. And a nurse coach holds a space for a patient, and I really want to hear your story. I want to really hear what your struggles are, what your victories are. I want to hear it all. And I have the time and the space to do that, and just listen to your story, because sometimes you just need to be able to verbally process what you're going through. And that's what I'm here for. I'm also going to ask you really powerful questions. If you've never been coached before, it's really hard to explain, but having those powerful questions set to you and having to think them through and really come up with an answer, it's really an experience that you can't describe in words until you've had it and felt it yourself. I also do a lot of reflective listening, and you will hear your own words said back to you a little bit different. And sometimes hearing it back just makes you stop and think, and it can just get the wheels turning and create epiphanies and really cool moments. So I also just offer insights and perspective, being in healthcare and primary care for 10 plus years, and just being a third party, objective person. I can kind of come at it from my own perspective and just share some insights with you, as well as education, because I am a registered nurse and I do have a lot of knowledge and background experience that I bring to the table, that I will be able to offer and share with you. And I just love this picture. Shout out to Susan Kilmartin for drawing and painting this picture. It's just so gorgeous, and it just shows what the coaching experience is like, because we are trying to get to this goal where you can create something that's beautiful and meaningful in your life. Like this little boy is reaching for the crayon so he can create something, and he stacks these books. And yes, maybe, okay, it's not the safest thing to do, but anyways, some of these books are small, some of these books are big. And when you're working towards a lifestyle change or a health change, you're trying to get your blood pressure under control, you're trying to get your weight under control, you're trying to manage your stress, some of the things that you're gonna do are gonna feel like huge steps, and you're gonna feel so accomplished. And some of them are just gonna be small little things that you might feel like are not making a difference, but they are. They all add up and get him to exactly where he needs to be, and it will all add up to get you exactly where you need to be. So I am super excited to launch the nurse coaching program with Veritas in May. Expect more emails and information coming out, but we're looking at doing individual sessions and group sessions, and I'll talk more about that in another video. I've already gone on too long, but I'm just so excited and passionate about nurse coaching and how I can work with people to make real lasting change and bring about more health and wellness and vitality in a time when we are just bombarded with chronic health conditions. And I'm so excited. So thank you for listening to me and hearing me out, and have a great day.